When you squat, your spine takes on an enormous load. To handle this, your lower back relies on soft discs between each vertebra, acting like shock absorbers, but when the weight is too heavy, one side of a disc can suddenly bulge outward, or even rupture. And right behind that disc sits a massive nerve, the sciatic nerve. The moment that bulging disc presses against it, everything changes. Instead of smoothly transmitting signals, the nerve gets compressed and irritated. A sharp, electric pain shoots from your lower back through your glutes and all the way down your leg. It can feel like burning, stabbing, or even a sudden jolt, like touching a live wire. That's called sciatica pain. And because this nerve also controls muscle movement, that pressure can cause weakness, making your leg feel unstable under the weight. So, how do you fix it? First, the goal is to reduce pressure. Resting from heavy lifts, improving posture, and using targeted physical therapy to stabilize the spine and take stress off the disc. As inflammation goes down, the nerve slowly starts to recover. But if the compression doesn't resolve, doctors may step in with steroid injections to calm the irritated nerve. And in severe cases, if the pain doesn't go away, doctors go straight to the source. They perform a procedure called a microdiscectomy, where a tiny incision is made in your lower back and the exact piece of the bulging disc pressing on the sciatic nerve is carefully removed. The moment that pressure is taken off, the nerve is instantly freed and the pain starts to disappear. So next time you squat, remember, it's not just about lifting heavier, it's about protecting your spine. If you want more videos that break down your body like this, hit subscribe, because what you don't see happening inside you can hurt you the most.